Now that we've talked about infections, let's talk about some of the drugs that we use to treat them. During this lecture, we're going to talk about the signs and symptoms of a secondary infection. We'll learn about the signs and symptoms of the common adverse effects of antimicrobial therapy. And we'll talk about the nursing assessments and the interventions for the common adverse effects that are associated with antimicrobial agents. So, allergic reactions, nephrotoxicity, ototoxicity, and hepatotoxicity. We divide antimicrobial agents into different groups, and they're classified according to which type of pathogen they work against. So, pretty self explanatory. Antibacterials work against bacteria, antifungals work against fungi, and antivirals work against viruses. And then we further subdivide them by chemical family. So, there's certain chemical families like penicillins, tetracyclines, and aminoglycosides. It's important to select the correct antibiotic. If we are just giving antibiotics unnecessarily to patients, that's a great way to increase resistance among the bacteria to these drugs. So it's very important that we base the choice of antibiotics on the sensitivity of the pathogen and then also pay attention to possible toxicity to the patient. So this is generally done by culture and sensitivity tests. The wound or a nasal swab, whatever it is we're testing for infection, culture is taken and sent to the lab. And what they do is they grow the bacteria from that swab, they grow it in the lab. And then they test different antibiotics on it to test which ones are the most effective. So, what you'll commonly see with antibiotic treatment is this swab will be sent, and then the providers will start what we call empirical treatment. They'll start their best guess of antibiotic right away so we can try to start treating the infection immediately. And then once those results come back from the culture and sensitivity, then they'll modify the antibiotic if they need to. Sometimes you'll see prophylactic antibiotics given. These are generally given to patients who are at risk for infective endocarditis before dental work or before other procedures that could put them at further risk for that. So, before we start a patient on antimicrobial therapy, we need to do our initial baseline assessment. So, we're going to find out the history of this current infection. When did it start? What have the symptoms been? What are they experiencing at this moment? Have they had things like this in the past? We're also going to find out their medication history. Have they taken medications for something like this in the past? Do they have experience with fighting resistant microorganisms in the past? Things like that. We'll obviously do a physical examination, assess any pain from the infection, any swelling, pus, the inflammation response, fever, these types of things. And then, obviously, also a psychosocial examination needs to be done. What is the impact of this infection having on the patient? Then, once we actually start treatment with antimicrobial therapy, we have a different set of assessments that we need to be doing. The three big things that we're looking for when someone is on antimicrobial therapy are nausea, vomiting, and diarrhea. These things happen a lot with these types of treatments. So, in these cases, we need to determine, are they related to the antibiotic or are they caused by something else? Obviously, we need to keep track of their hydration if they're experiencing these things. Make sure they're staying hydrated, make sure we're keeping track of their electrolytes, all of that. And report diarrhea, abdominal pain, any of these symptoms to the providers as well. Now, with antimicrobial therapy, particularly with broad spectrum antibiotics, it's not uncommon for a patient to get what we call a secondary infection. And this is when the therapy we're giving kills off a bunch of bacteria or a bunch of microorganisms, but then that leaves other microorganisms a chance to proliferate, ones that are resistant to that particular drug, and then a different infection arises. So, what are some signs and symptoms that you might commonly think of for a secondary infection? Some common ones you'll see are oral infections, either like a black, furry kind of tongue or white patches in the mouth. Both of those can definitely happen. Lesions, or itching, vaginal itching, anal itching. Those are common signs and symptoms of secondary infections. And then also another big one is it can produce like severe life threatening diarrhea if the treatment from the antibiotic left bad bacteria to grow in the gut and cause diarrhea. The next thing we're looking for during antimicrobial therapy are signs of allergic reaction. So we're looking for signs of allergies or anaphylaxis. And these can range from being mild all the way to being fatal. And they also have a pretty broad time range. They can start within 30 minutes after administration, or they can even happen days later. So there are things that can happen are anaphylaxis, laryngeal edema, shock, dyspnea, skin reactions. Those are common things that you might see. So, if we're seeing things like this, we need to determine if they're allergies, like a skin rash, edema, or dyspnea, or are they GI symptoms? Which one are we experiencing? Are we experiencing an allergy, or are we experiencing something else going on? And again, these reactions can sometimes be delayed several days. So, we need to keep an eye on them for a while, especially after they're trying a drug they've never used before. And the patients that are most likely to exhibit an allergic drug reaction are those patients who have an increased risk for allergies in general. So, patients with asthma, with allergies, rhinitis, or patients taking multiple drugs because they could experience cross reactivity among the drugs. And finally, when we're giving antimicrobial therapy to our patients, we need to assess for common adverse reactions they can have. Lots of toxicity is associated with these agents. So, nephrotoxicity or toxicity to the kidneys is a big one. So, we're checking for things like increasing BUN, increasing creatinine, a decreasing urine output, or changes in the urinalysis. Then hepatotoxicity or toxicity to the liver is another big one. So, same thing. We're assessing for any pre existing hepatic disease, and then we're checking for any abnormal liver enzymes. We're following those labs to see what's going on, if anything's changing. Then another common uh, piece of damage that can be done with this therapy is ototoxicity or toxicity to the ears. So, damage to the eighth cranial nerve can lead to hearing loss, and that can happen with these medications. And finally, we're assessing for blood dyscrasias. So, any blood abnormalities, things like anemia and thrombocytopenia, can happen fairly frequently with these types of medications. As we're doing all these required assessments, we're going to be implementing the required therapy for these patients. So, we're going to be making sure that we're following any precautions for infection transmission that we talked about in the last lecture. So, do they need to be on contact precautions, airborne, droplet? Do they need a protective environment? Anything like that, or just standard precautions? We're always monitoring for phlebitis when these medications are given IV. That's true for any IV medication, but some antibiotics can be especially damaging to the blood vessels and to the tissue of the arm if they go out, if they infiltrate out of the blood vessel. So it's really important to keep an eye on the IV and take it out if shows that it's having signs of not working properly. Generally speaking, it's important to give these medications on an established time schedule and not to fluctuate from that very much. We need to make sure that if it's a drug that should go with food, it's administered with food. And if it's supposed to be on an empty stomach, we need to administer it between meals. And finally, we have to make sure that we're paying attention to drug allergies. And if a medication is ordered that might have a cross reactivity with other antibiotics of similar classes, that we're coming to the doctors and questioning, are we sure that this is okay? Should we give a different antibiotic because of this allergy? Can be a common thing that providers can sometimes miss is these cross reactivities. So it's something to be aware of. So, what are some appropriate nursing interventions that we would do for the common adverse effects that we're going to see with these medications? Let's look at some of them. The one we're going to see a lot, the big three again: nausea, vomiting, and diarrhea. So, some easy interventions we can do are to give them with food if possible, if the drug allows. Or the healthcare provider can switch to parenteral medication if it's a possibility for the patient, and that can help with some of those symptoms. If a patient is showing signs of secondary infections, we can notify the healthcare provider immediately of these symptoms so we can then adequately treat with different antibiotics or find a new plan going forward. If we're seeing patients that seem to be experiencing allergies or worse anaphylaxis with these medications, we need to be monitoring patients that we suspect of these issues closely, right? So the patients that already have other allergies, patients with asthma, rhinitis, patients taking multiple different meds for allergic response. We need to be watching them really carefully for 20 to 30 minutes after administration to make sure that they won't experience yet another allergy with these medications. And finally, we just need to be treating the allergic responses the way we should be. So we talked about this earlier, giving Benadryl. If there's an anaphylactic reaction, that we are responding quickly. We're calling the emergency response team. We're getting the oxygen going, protecting the airway, giving Benadryl, all those things. Some more interventions we can do for some of the other toxic type effects of these drugs are for nephrotoxicity, for example. We can monitor the BUN and the creatinine. We can pay close attention to the I's and O's. And if there's any declining urine output, particularly less than 30 milliliters an hour, we definitely need to be reporting that to the providers. While we're looking for signs of hepatotoxicity, if we're seeing that, we're monitoring labs to look for any changes in the liver enzymes. We're looking for signs of anorexia, nausea, vomiting, jaundice, which is like yellowing of the eyes, the skin. Any of those things are signs of hepatotoxicity and need to be reported. For ototoxicity, we need to report hearing impairment to the providers, dizziness, or tinnitus, because any of those can be signs that the medication is starting to affect that eighth cranial nerve and affect hearing. For blood dyscrasias, we're looking for and reporting any signs of sore throat, fatigue, elevated temperature, skin hemorrhages, bruises, because these things are demonstrating that there could be a decrease in white blood cells. That's what sore throat, fatigue, elevated temperature, that's what that can mean. It means they're having some effect on the immune response. And then for skin hemorrhages and bruises, that's showing us that something is being affected with the clotting capabilities of the blood. So any of those signs show that something is off with the blood counts, and we need to be reporting them and checking the labs to see if there's something going wrong in the blood. And finally, for photosensitivity, if we're giving these medications to patients that are going to be out and about going into the world, we have to make sure we educate them. They need to wear their sunscreen and need to avoid ultraviolet light because these medications can commonly cause photosensitivity and they can get bad sunburns. Okay, let's check our knowledge. What are the big three adverse effects associated with antimicrobial therapy? A, skin rash, nausea, or diarrhea. B, nausea, vomiting, and diarrhea. C, vomiting, constipation, and lethargy. Or D, sun sensitivity, diarrhea, and allergic reaction. If you guessed B, you are correct. Nausea, vomiting, and diarrhea are the really big things that you see with antimicrobial therapy. Although the other things listed in the other answers are also things that you will see, but those three are the most common. So, when we have patients being treated with medication for infection, we have a lot of things that we need to educate them on. We need to teach them about the importance of getting adequate rest, adequate nutrition, particularly protein and vitamin intake, and lots of hydration, including electrolytes, particularly if they are vomiting or having diarrhea. We need to teach them about infection prevention. So, hand washing, particularly when preparing food. Covering the mouth when coughing or sneezing, not leaving tissues laying around the house, these types of things. And their personal hygiene, making sure that they're keeping their linens clean, making sure they're wearing clean underwear, making sure they have meticulous hygiene for perineal area, for the hands, for mouth hygiene, all of these things. We need to teach them if they're being treated for sexually transmitted infections, they need to refrain from sexual intercourse during that time. And that we need to teach them about the common adverse effects that we're looking for and what things are normal and what things need to be reported to the provider. And finally, it's super, super important that patients understand that they need to take the whole course of the drug in order to prevent microbial resistance to the antibiotics from building up. A lot of times, patients will want to start an antibiotic, but then stop it once they feel better, and they won't finish taking it for the whole 10 days or however long it was prescribed. But what that does is it then kills off some of the bacteria so they feel better, but then the bacteria that still haven't been killed off yet, then they have a chance to evolve essentially and build up more immunity to that medication for the future. Let's consider this patient. A man is admitted to the hospital for IV antibiotic therapy related to osteomyelitis. The nurse begins the admission process by taking a detailed history. The nurse asks the patient about his current symptoms and complaints, previous infections, and response to antibiotic therapy. When the nurse asks the patient about any history of sexually transmitted infections, the patient responds, "That's none of your business." How should the nurse respond? Why is it important to obtain a history regarding sexually transmitted infections? So, what do you think? The reason that we need to be assessing for this history is because sexually transmitted infections are a part of his infection history, just like anything else that we're asking about. So that's the reason the nurse needs to be asking about it, is to find out what infections the patient has had in the past and what medications the patient may have already been treated with, to find out if there were any allergic reactions to those medications, if medications were effective, or if the patient may be colonized with drug resistant organisms. So the nurse could respond therapeutically with something to the effect of, "I can see why you would say that. We ask because we want to know your history of antibiotic medications for any type of infections, just like we would for anything else." Something like that. Validate the patient's concern first. "I understand why you would say that." And then also explain why we're asking it so the patient can better understand why we need the information. You can also do something like explain HIPAA to the patient. Explain, because of HIPAA, this information all remains private and it won't be told to anyone else. It is simply to inform our care and make sure we treat you properly.